Welcome to AETCM, the emergency medicine channel. Shall I start, sir?
Yes.
Presenting the case of a 47-year-old male who came to ER with complaints of pain and a wound around the right great toe, along with diffuse sweating and breathing difficulty since last 2 hours after getting a bite from a scorpion in the farm today morning. So at an initial 10-second assessment, the patient was conscious oriented. He was able to complete full sentences and the assessment of the airway was patent, but we were found to have increased salivation was present, and there was no presence of any stridor. And since there was presence of increased salivation, we had initially placed a suction and we had done the suctioning of the airway, following which we had assessed the breathing of the individual. The patient had a respiratory rate of 26 per minute with a saturation of 86% in room air, and we had auscultated, and on auscultation was found to have bilateral, he was having diffuse repetitions. So we had initiated him on NIV support as the patient had shown signs of we came to an initial conclusion that most probably it could be a pulmonary edema. So, and we had kept the patient in a head in the propped up position. And on circulation wise, the BP was 180/110 millimeters of mercury with a heart rate of 120 per minute, and the capillary refill time was less than 3 seconds. And the disability wise, the GCS was C4V5M6. The pupils were 3 mm and sluggish reaction. And we had also checked the exposure. We had checked the GRBS. It was 76 milligram per deciliter, and we had also there was no presence of any external rashes all around the body. And we had checked the wound site also. The wound site, there was presence of a mild local rise of temperature, and also a surrounding erythema was present along the bite site. So we also assessed the pain score of the individual. The patient had a pain score of 7 out of 10. So we had given initially an injection morphine to give stat was given for this individual, and following which we had went to the adjuncts to the primary survey. And in that we had also initially done a point of care CBC CRP was done for this individual, which showed a total count of 14,000 with an HB of 9.2 and CRP of 21, platelet of 1,68,000. And we had also done an arterial blood gas for this individual. It showed a PO2 of 66, pH of 7.38, and PCO2 of 28, lactate of 4, creatinine of 1.45, and bicarb of 21. We had also taken an ECG for this patient, and which showed a sinus tachycardia. Following which we had also done a point of care ultrasound for this individual. And we had the patient was found to have diffuse B lines across all 6 lung fields which we had checked, and there was no absence of any threat sign in this individual. We also checked the LV contractility. The patient had a good LV function, and the IVC was more than less than 50% collapsing in this individual. So we came to a primary conclusion: the patient is in a pulmonary edema. We are then asked regarding the history of the presenting illness. As the sample history we are taken, and in the sample history, the patient was a 47-year-old male. He had no comorbs. He came to ER with complaints of pain, swelling, and a wound along the right great toe, which was following a scorpion bite. It occurred around 2 hours back. And initially the patient had symptoms of sweating, diffuse profuse sweating, and increased salivation was what he felt as the initial symptom. Following which, since last 1.5 hours, he developed increased breathing difficulty. So that was, and he was not able to lie down flat, and he was having severe orthopnea, and also he was as he was trying to sleep, he was not able to. He was waking up from the sleep due to the breathlessness. He was having PND2. He did not give any history of any fever, vomiting, or diarrhea, or he did not give any history of any excessive erection of the penis. He did not give any history. He did not give any history of any chest pain or palpitation. He did not give any history of chest pain or palpitation. And he did not give any history of any change in behavior as per the bystander. We are also taken history from the bystander. So they are also told that he did not have any change in the sensorium and also the patient did not give any history of headache or blurring of vision, and or any slurring of speech or any facial weakness. There was no history of any weakness of limbs, and there was no history of seizures. There was no history of any diffuse rashes all around the body. So allergic history was nil. Past history, he was not having any home-ops. Medication history is also, he is not having any using any regular medications. So then we had moved to the we had sent a few lab investigations also for this individual. In this we had initially sent a total CK, CKB and total CK was sent for this patient, along with the cardiac enzymes as such, along with RFTs, LFTs, and the serum electrolytes was sent, and along with that the CBC also was sent. The total.
So what's your final diagnosis?
The patient has, we came to a final diagnosis, the patient had a scorpion envenomation. So due to the scorpion envenomation, the patient has now gone into a acute pulmonary edema. So most probably due to the scorpion bite is what.
Is the scorpion bite that has caused the pulmonary edema, or can it be anaphylaxis?
Anaphylaxis, we had checked through the skin rashes throughout the body. And the definition of anaphylaxis basically comes across that there must be a skin involvement along with the compromise of airway, breathing or circulation. So this patient had breathing wise, the patient had issues, and then bronchospasm was also while present, but the patient did not show any diffuse rashes along the body. So we came to a primary conclusion, it most probably could be
it can be the scorpion bite that has caused the autonomic symptoms precipitating the cardiogenic pulmonary edema.
Yes.
But anaphylaxis cannot be ruled out actually, because breathing is involved. Initially airway has secretions, fall in saturation. So anaphylaxis should also be kept in mind. So here you clearly know that this is a scorpion bite.
Yes.
So if this was an unknown bite, then how you will approach and how you will come to the conclusion that this is a scorpion bite?
Basically, we should look for the local site wound reactions. So if there is presence of.
So what are the common bites that can be seen in our setting?
The common bites mainly involve the initial commonly can be present of snake bite.
Snake bite should be your first diagnosis.
Yes.
Okay.
Snake bite or then rodent bites. That can also be another possibility. So they are the most common which are involved. The other bites mainly involve the stings. Of example, bee and wasp stings
can be there.
That can be the other possibility, or spider bite. Spider bite is another possibility. Then
how you come to the diagnosis that this is a scorpion bite? Suppose this was an unknown bite. Then how you will come to the diagnosis that this is a scorpion bite and this is not snake bite or bee or wasp sting?
So in the usually in cases of wasp sting and all, there will be presence of multiple bite marks across the body. So in this patient, the patient had a single bite mark. And in bee sting, there will be a single bite mark.
Will be there.
Yeah, but there will be a presence of a stinger. In this patient, we had examined, there was absence of any stinger. So that's why.
What's the difference between bees and wasps?
It's mainly on the color.
No, I mean like in the bite.
Yeah, bite usually there will be presence of a stinger, and it will be usually a single bite in case of a bee. In wasp, it will be presence of multiple bites. So in case of a wasp sting, we can see multiple bite sites. But in this patient, the patient had only an individual single bite site. So that's why we came to a conclusion that even if it's a bee bite, like bee sting, again there could be a presence of a stinger. There was absence of a stinger in this individual. So that's why we came to a conclusion that it could be either a snake bite or a scorpion bite if it's an unknown bite. But the patient had seen the
how did you ruled out snake envenomation in this patient?
Snake envenomation is usually ruled out by we check the initially whole blood clotting time is initially checked.
No, for this patient, as per the history, how can you rule out? You look for signs of neurotoxic or hemotoxic envenomation. That was not there.
Yeah, so this patient did not show any signs of profuse bleeding as per any orifices, or even from the local side there was no profuse bleeding. And the patient did not have.
Suppose if a patient comes with an acute flaccid paralysis without any history of any bite, can you suspect any snake envenomation?
Yes.
Which snake?
Usually in case of cobra,
No fang marks.
no fan marks. Crate,
Crate can be
yeah,
there.
yeah.
The bites are hypodermic needles, so they're not sufficient enough to cause the fang marks.
Yes.
Okay, then how you will diagnose is that from the examination as a scorpion bite.
It's not
Symptoms wise, there can be excruciating pain.
Yes.
Pain out of proportion to the bite site.
Yes.
The areas involved. That is one of the clinical features the patients will say in the case of a scorpion bite. Second thing,
There will be a
look for the
mild
tap sign.
yeah.
When you tap on the site of the scorpion bite, the patient will have severe pain. That is called the tap sign. These are more or less diagnostic of a scorpion bite.
Right.
So this is how you will come to the diagnosis of a scorpion in an unknown bite. You have ruled out snake bite, snake envenomation, bee, wasp. Then you look for the excruciating pain and the tap sign. This will point towards a scorpion bite. Then what's the mechanism of action of the toxin?
The toxin mainly acts as a neurotransmitter. It increases the neurotransmitter release. So that's why there will be increased acetylcholine again receptors. So there will be presence of both cholinergic and there will be also presence of adrenergic effect, also sympathetic stimulation. Also. So due to this increased cholinergic effect, the patient can have bronchoria. So increased bronchoria along with salivation, bronchospasm, and patient can also develop diaphoresis, severe sweating along with palpitations and also priapism. So priapism is one of the features which can be seen usually in a scorpion bite, and also symptoms like vomiting, diarrhea can also be present.
The life-threatening complications are mainly due to the autonomic overactivity.
Yes.
And also this venom contains phospholipase A2, especially the Indian scorpion contains phospholipase A2.
Yeah.
That can cause diffuse alveolar hemorrhages, DIC and other complications also.
Yes. So that was the final conclusion which we came into. So in this individual, the patient had hypertension and tachycardia. So patient was showing autonomic.
So what are the symptoms of scorpion bite? The local and the various systemic symptoms.
So in scorpion bite, basically the patient can present with autonomic symptoms. So that is one.
Say the local symptoms, then come the systemic symptoms.
Yeah. So in the local symptoms, basically there will be presence of intense pain. Intense pain along with there will be a presence of a local reaction along the bite site, a diffuse erythema that is which can be present along the bite site. That is usually it is present as a local reaction. Then systemic symptoms mainly involves the autonomic symptoms, or it can be presence. It can be adrenergic or cholinergic symptom, or another possibility is patient going into anaphylaxis. So these three are the various spectrum of symptoms which the patient can present. So in these cholinergic symptoms, usually as I have mentioned before, it is usually because of this increased cholinergic activity. Parasympathetic activity, there will be bronchoria. So increased bronchoria can be presence of bronchospasm. Patient can go into priapism, painful erection of penis. Along with that, patient can develop lacrimation, diaphoresis, diffuse sweating, vomiting, diarrhea. So those are the increased secretions which is initially found. Or the patient can go into a sympathetic stimulation. Because of that, patient can go into hypertension, tachycardia, and due to this, patient can go into a cardiac failure, can go into a cardiogenic shock. So that is what are the features which can be present. This is usually in cases of cardiovascular effects of a scorpion bite. There are actually different classes of scorpions, different groups of scorpions. So the Indian red scorpion is actually the Mesobuthia type. So the Mesobuthia type
is the Indian red
scorpion. So that's usually causing cardiovascular symptoms. There is other groups of scorpion which is present in the North American, South American belt. Usually in those scorpions, they have neuromuscular symptoms basically. So in such patients, they can develop usually presence of increased jerky movements of limbs, and there can develop altered sensorium. There can be presence of seizure-like episodes because they have increased jerky movements of the limbs. So that is what is usually found.
So basically there are local symptoms and systemic symptoms. In systemic symptoms, there is again GI symptoms, respiratory symptoms, cardiovascular symptoms and CNS symptoms. Predominantly the Indian red scorpion presents with the cardiotoxic symptoms.
Yes.
Okay.
So
what are the grades of scorpion envenomation?
So the grade of scorpion envenomation is in 4 grades. So grade 1 is usually the local site effects only.
Pain and paresthesia at the local site.
In grade 2, it's usually there can be presence of pain and paresthesia distal from the local site. So it might distal effects. So that's the second grade. In grade 3, the patient can go into the autonomic dysfunction, and also associated cardiotoxicity can also be present. So that is usually the parasympathetic and sympathomimetic actions. Both actions can coexist. So that's how it will be presented. In grade 4, the patient can go into cardiogenic shock. So progressive cardiogenic shock, or it affects the other organs like renal and liver dysfunction.
So basically, grade 1 will be pain and paresthesia at the local site, and grade 2 will be the symptoms distal to the local site, and grade 3, one of the systems are involved, and grade 4, multi-system involvement.
Yes.
Okay, so how will you manage the case?
Yes. So in our
the first priority will be pain management.
Yes. So initially in this individual itself, the patient had a pain score of 7 out of 10. He was having intense pain. So that's why we had initially given opioids for the pain management.
Is morphine indicated in scorpion bite?
Opioids are indicated in...
Can morphine be given?
Morphine, there's no... morphine can...
Previously, there is a school of thought that for pulmonary edema, for the fluid shift, we will give morphine.
Yeah.
But this is one case where morphine is not indicated. It can again trigger the autonomic overdrive and worsens the condition. So in the case of scorpion bite, morphine is not recommended for pain management. So what all other options you can give?
If the patient is complaining of mild pain, we can go with NSAIDs. But if your patient is still complaining of severe pain, we can go with even local anesthetic along the site without...
You can give local infiltration. Without adrenaline, you can give local infiltration. Or you can give blocks. You can give blocks.
Yes.
Okay. Yes. So pain management should be addressed first.
Yes.
Because again, if the pain is not controlled, the autonomic overactivity will again worsen, and the patient can go into systemic failure. So pain management should be your first and foremost priority.
Yes.
Okay. Then...
So in this patient, the patient more than the local symptoms, the patient also showed systemic symptoms. So the systemic symptoms mainly it is mainly based on the Indian red scorpion. The patient basically has cardiovascular symptoms mainly predominantly. So there is a specific protocol to follow. It's called Bavaskar protocol. So in Bavaskar protocol says that if the patient is having it is...
Can you just list the stages and the management of Bavaskar protocol?
Yeah, so usually it is based on actually 5 stages. So in stage 1 is usually between 0 to 4 hours of presentation. The patient can have sweating, patient has salivation, mydriasis, and also priapism, hypertension or hypotension with cold extremities. In such patients, the presence of scorpion antivenom, and along with prazosin is indicated. So prazosin is usually given at a dose of 30 microgram per kg, maximum dose of 0.5 mg. It's in mainly in pediatric group also. They are more prone to the cardiovascular effects of scorpion bite. So that's the 0.5 mg is the maximum dose of prazosin which can be given. It is usually given.
Repeat this.
Yeah, every 3 hours we repeat till the toxicity effect completely subsides.
Usually with a 4th dose, most of the systemic symptoms will resolve.
So that is in stage 1 management. In stage 2, it usually presents within 4 to 6 hours post the scorpion bite. So in that there will be presence of systemic hypertension.
How the prazosin act actually?
Prazosin is an alpha blocker. So it mainly reduces the sympathetic activity.
The sympathetic overdrive is reduced.
Okay. So that's how the activity occurs. And the patient will again systemic hypertension, tachycardia with cold extremities. In such patients, we should again the ASC with prazosin is the initial line of management in stage 2. Stage 3 usually presents within 6 to 10 hours post the bite. In that patient will have hypotension with pulmonary edema and tachycardia. So in such individuals, the patient in hypotension, we have to give an additional drug of dobutamine. So dobutamine is the additional drug that is usually again given at
dobutamine is the drug of choice in the case of a
cardiogenic shock.
secondary to a scorpion bite. Okay.
So in such that individuals, they have to be kept on NIV also. And in stage 4, this is actually presented within 0 to 6 hours of presentation itself. In such individuals, they present with massive pulmonary edema and hypertension. So in such individuals, we start on NDG and Trazocin along with the ASV. So that is the difference in line of management between stage 3 and stage 4. Stage 5 is patient again having warm extremities, tachycardia, hypotension, and also present pulmonary edema. So pulmonary edema with the hypotension, again dobutamine becomes the only line of management. So this is how the Bavaskar protocol goes.
Can you just brief something about the antivenom?
Yeah, so the antivenom usually in India, we have this the Hopkins Institute along with they are the main
Hopkins pharmaceuticals, which has the scorpion venom antiserum.
Antiserum is what is present.
So we will give at a dose of 30 ml in
100
ml
in
NS over 30 minutes.
30 minutes is what is
So
given.
irrespective of the pediatric or the adult, 30 ml is given at a fixed dose in 100 ml over 30 minutes.
30 minutes. And again, we have to reassess within every 1.5 hours. So that's usually the reassessment time. And it is the dose of the antivenom is irrespective of the age and the weight of the individual. So that is the important thing to note.
Same like ASV.
ASV itself. And then atropine can be given only if there is presence of severe bradycardia with the AV block. Otherwise, atropine is contraindicated in cases of scorpion bites.
So just summarizing, you will diagnose a scorpion bite based upon the history like excruciating pain. And on examination, you will look for the TAP sign. Come to the mechanism of action, the scorpion, Indian red scorpion predominantly has a cardiotoxic effect. The phospholipase A2 can trigger gastric and diffuse alveolar hemorrhages and also cardiotoxicity. The key pathogenesis is the sympathetic autodrive, the autonomic symptoms that has precipitating the cardiotoxic effects. Then we discuss the grades of scorpion envenomation, the grade 1, grade 2, grade 3 and the grade 4. Then
we have discussed regarding the management,
which is called the
Bavaskar protocol.
And also we have discussed the
local site management also.
The snake, the scorpion antivenom and also Trazocin, which is the drug of choice in the case of systemic symptoms in the case of scorpion bite.
And in case of
and more importantly, pain management should be given. Okay. And also morphine is not indicated in a case of scorpion bite. Okay, thank you.
Thank you.